Wow, that really just puts it all into perspective, and honestly, the things that we all just take for granted, and we don't even think about the way that it can just be taken away in that way, but particularly as we see climate change having more and more of an impact. So thank you so much for that, Benjamin. Appreciate that. Next up now, we are going to be moving on to a panel with a real-time case study to illustrate what is in fact required to design and defend a proposal for adaptation funding in support of climate resilient health systems. So we're going to be welcoming to the stage 3 panelists who are all working collaboratively to prepare Malawi for the current and future climate threats to human health. And to moderate that panel, please welcome to the stage Evie Gray, Global Health Communications Manager for GSK. Welcome.
Thank you for that introduction. As you said, we're here to talk about a real-time example of unlocking some of these big funds that are out there for health adaptation. I think it follows on really nicely from the session that we just heard earlier this afternoon, where we heard about the importance of financing for climate preparedness in the health sector. So hopefully you'll come away from this with some understanding of what's actually already happening in that space. And in particular, we're going to be talking about a Green Climate Fund project. For those of you who don't know what the Green Climate Fund is, it's the world's largest climate fund, and it's essentially the funding arm of COP, which we've also been hearing a lot about over the last couple of days. It hasn't yet, as far as I know, although I'm very happy to be proven wrong, funded any health projects. It's largely been focused on livelihoods, infrastructure, and agriculture. And from the conversations I've had and the things that I've learned, that is because the health community isn't sure how to access this funding, how to apply. And you might be wondering what on earth a biopharmaceutical company has got to do with starting to unlock some of that funding. We've worked with Save the Children for over 10 years now to reduce child mortality through lots of different interventions. And a couple of years ago, we heard in conversation with them that they had been accredited by the Green Climate Fund and could now start applying for funding. This was at the same time that as a company, we were starting to look at the mitigation side of climate change. So we were setting our own net zero, nature positive goals, and increasingly hearing from patients and partners and our employees about the impact of climate change on health. So we spoke to Save the Children and said, how can we support your new accredited status? Is there anything that we can do? And we heard that although there is the potential with the Green Climate Fund to unlock tens of millions of pounds worth of funding, actually getting the project design itself is really costly. And they said it'd be great if you could help funding with that. So we're funding 2 project designs, one in Malawi and one in Senegal. And you've got an amazing panel here today of experts who are working on the Malawi project design. So you've got Hendricks, who you heard from yesterday, who's from the Ministry of Health in Malawi, and he is the focal point for climate change and health in the Ministry of Health. And we've got Burcu from Save the Children Malawi as well, who's been working closely with Hendricks on that. Before we delve into the questions, Burcu's got a video which she would like to share with us. Sure. So I'll leave it to you to introduce that.
Thank you. I'm trying to move this so that we can get to it. Thank you, Evie, for that, and thank you to the organizers for making it possible for us to be here today. I want to start by saying that at Save the Children, we see the climate crisis as a child rights crisis. We've done some projections with climate scientists that show that a child born in 2020, as compared to someone born in 1960, will be experiencing around 3 times more wildfires and crop failures and floods, 2.6 times more droughts, and almost 7 times more heat waves. Surely all of these climate events will have substantive impacts on health for us to be looking at addressing. At Save the Children, we try and listen to children before we do anything. So I'd like to bring children's voices from Malawi to this global summit. But before we listen to them, I want to provide some framing. For the last 15 months, Malawi has been going through the worst cholera outbreak of its history. The cholera outbreak is a direct outcome of floods experienced as a result of cyclones Ana and Gombe that happened early last year, which caused a lot of displacement, and poor sanitary structures in the camps led to this cholera outbreak. So far, we've seen about 53,000 cases and about 1,600 deaths from the outbreak. If we go back a couple of years to 2019, the impact of Cyclone Idai saw health facilities in half the country partially or fully destroyed. Fast forward to last Sunday. Cyclone Freddy is wreaking havoc in the same southern districts in the country. To date, we have more than 200 people dead, around 20,000 people displaced, 45 camps have been set up across the southern areas, and people are flocking to them. Again, health facilities, roads, schools have been damaged. A national blackout is going on since Sunday. Cyclones are becoming an annual event in Malawi. Malawi's healthcare system is battered by climate change. We therefore have a great sense of urgency that we need to rebuild a climate-resilient health infrastructure and system in Malawi. With this background, let's now hear from the children about how the cholera outbreak has affected their lives. Can we have the video on, please?
Ndakhala chakumazulu mava mimba mwangu bwada ndindava mimba wangu bwada ndapita kutolera inawo ndambusegula inawo makazi ndizikusinthabi segula mazokhawo inako mtengo wachipatala tipange daita foka
namba kusanza komanso kusegula mimi popo nathamangira kuchipatala kwa sikulu ya lumimba tinagona kwa masiku awiri
kweni mbwe mwana mwambula kuyembekezera cha akamba kuluwala mbwe akamba kufumira na ubokola wena utanga cha business na kalanga waka chifuka cha masuga ya unisanga ya kolera
monga tikumbale ine kholo nali wokhuzidwa chifukwa chone kuti pa nthawi imene mwana amadwala sukulu samapita ndi zambiri zimene zinali zofunikira pa moyo wake zinakhanga zinasokonekera pamene sopano mwina oyamba sukulu mwina tina timene amaphunzirazi zake yoti namudusa pamene ne moyo wanga ulodandaula nokhuzidwa kuti matenda awo anakhanga tasokoneza zina mkati mwa sukulu lake.
We were really affected. Learners were afraid to come to school in fear of getting the virus. So the school enrollment dropped.
Kolera ikasuzwa kuno kwitu chomeni area jarafukuwa ya TA para wakati wapulika kuno yasuzwa kolera pafukutika kuendelana na bantu bakufika vinyaka vya mwatie jarafukuwa mwene mungu.
Suzwa nkaona kuti ni maji ayo tikumwa chifuka tikuyatolanga mdamu ndi tikugulisa ntchito nga maji akumwa kweniso yakabebi chili chose ko ulini yakabebi
vuto la mazi ndi imene kuno kwathu kwa Khonde kuli vuto lalikulu kwambiri okuti chilichonse pano anthu akutenga madzi ukutenga kunyanja kuja kumene kusamapangira zoyipa chiyani madzi acho tikumwa ombera chitetezo kuti vuto lalikulu ndi madzi kuno kwathu konse kuno mafumu 12 palibe chimene chiwo madzi kuti anthu adatengapo madzi wa mjigo palibe.
Thank you for bringing the voices of the people that are really impacted by what's going on with climate change and health. I think we can sit and have those discussions among us, but it's really great to make sure we bring those voices to the table as well. As we just saw there, the impacts of climate change on health are huge in Malawi, and a prerequisite for applying for Green Climate Fund funding is for governments to be heavily involved in the projects. And that's why it's so great that we have Hendricks here today. As we've heard across the last couple of days, it is not a given that governments see the link between the two and prioritize it. So Hendricks, I really wanted to ask, how did you get that to happen in Malawi? What worked to convince the government to see this as a joint crisis?
Thank you very much for giving me this opportunity. Once again, I'm going to talk about the journey to climate change and health within Malawi, especially in the Ministry of Health as up to date. Actually, it was in 2014 February where Malawi was privileged to champion a project known as Global Framework for Climate Services, which was funded by the NORAD government, and mainly it was focusing on adaptation for climate services for health sector. And during that year in 2014, then we managed to create what you call the Health and Climate Core Team, which its function was to oversee the implementation, evaluation, monitoring of the activities on climate change and health across the country. And this, it was, as I indicated, it was a multi-sectoral as well as multi-stakeholder membership, academia, research, media, environmentalists, faith-based institutions, government institutions, and other NGOs relevant in the implementation of the climate change in general. And the Health and Climate Change Core Team had the prescribed terms of reference and the roles and tasks to be implementing during that period. Then after that, after the creation of the Human Health and Climate Change Core Team, then we were privileged to brief the senior management authorities within the Ministry of Health to orient them on the need of the human health and climate change within the Ministry of Health. Why did we do that? Ministry of Health's core function is to treat the disease and to prevent. Its core function is not about climate change and health. So we had to convene the senior management and orient them and brief them and to understand that indeed the impacts of climate change has a negative impact on the health system, so that they need to support and appreciate and understand that indeed we should include human health and climate change in the ministry as one of the priority areas. In addition to that, we're also privileged to have what you call the FCDO project, which mainly focus on the integrated surveillance component, but all these projects, they phased out. Now, how did we manage now to be where we are? The first achievement is we have been mainstreaming climate change into health policy and the plans. How? I'll give very specific examples how far we have done this. We have made inclusion of the thematic area in the National Environmental Health Policy That is the core function, namely the emergency health and climate change. We have also, on the mainstreaming, we have also made integration of climate change and health into the health sector strategic plan. 3, we call it HSSP 3, 2023 to 2030. This is the strategic plan for the health sector. And we are privileged that in the health sector strategic plan 3, 2023 to 2030, under pillar number 5, under social determinant of health, human health and climate change has been prioritized in the health sector strategic plan, and it has been approved. Furthermore to that, we have made integration of climate change and health into what you call the district implementation plan. These are the annual plans, budgets for each district council in Malawi annually. Like this time, they are preparing the annual budget for the district. We have managed to convince the district council to include in their budget issues to do with human health and climate change. And further to that, we have also come up with what you call the district focal persons or focal points in each district in Malawi. In the 29 districts, we're having the human health and climate change focal points, where we're seeing issues to do with human health and climate change across the country. To add on that, also the health sector is now a member of the National Steering Committee on Climate Change and Disaster Risk Management, which is a national level, which is being chaired by the Environmental Affairs Department, which is the national designated entity entrusted to oversee issues to do with climate change in the country. We also developed what you call the first communication strategy on climate change and health. Currently, we have developed what you call the first draft on the health sector national adaptation plan. We have also developed the health advisor on the extreme weather events, which I indicated that this is in different languages, English as well as local languages for the community, which are being accessed or can be advertised in the newspapers as well as in the community local radios. That's on the mainstreaming. On the intersectoral coordination and mechanism for climate information, I have indicated that the Human Health and Climate Change Core Team, which was created with the terms of reference, as indicated, a multisectoral, which is functional, and we meet quarterly. Every year we meet quarterly to discuss and emphasize on the issues to do with human health and climate change. I need to emphasize on the Human Health and Climate Change Committee that it is very, very important. I'll cite one of the example. In Malawi conducted what we call the Vulnerability and Adaptation Assessment in 2014, and the report is available. We engaged the consultant to do the Vulnerability and Adaptation Assessment on the health sector. After the report was presented to the Human Health and Climate Change Committee, we had to review the report, and we realized the report was substandard, and we had to review it and make some changes. And because of the input from the Human Health and Climate Change, what they reviewed it, so the members of the Human Health and Climate Change became part and parcel of the co-author of the Vulnerability and Adaptation Assessment, apart from the consultant as the main author. So the Human Health and Climate Change core team became part and parcel of the co-author of the Vulnerability and Adaptation Assessment for the health sector and climate change and health. On the capacity building, we have done what you call the incorporation of the module on climate change and health in what you call the National Health Surveillance Assistant curriculum. When you talk about the National Health Surveillance Assistant curriculum, these are health surveillance are the Ministry of Health, community-based health workers, and are the first point of contact for the health system within the communities. So in their training curriculum, we have incorporated a module on human health and climate change. Not only that, we have also managed to come up with a training manual for the Village Health Committee on climate change and health in the local languages. Also to that, we have also managed to review what you call the annual contingency, emergency, and response plan for emergencies, the disasters like we're encountering now. Also to add on that, we also managed to convince Malawi College of Health Sciences, which is a tertiary institution which trains the paramedics on health issues. We managed to incorporate one of the modules on climate change and health in their training curriculum for the health professionals. In terms of awareness and raising and risk communication, we managed to train the national and the district health workers who are oriented on human health and climate change, as well as the community population. About the development and the testing of different climate-sensitive health services, we managed to come up with what you call the risk mapping. And this risk mapping platform is for visualization of the country climatology and the monitoring of key climate variables. And this was based on what you call the Department of Climate Change and Meteorological Services, DCCMS. We work hand in hand. And to add on that one, we managed to sign what you call a technical agreement between Ministry of Health and the Department of Climate Change and Meteorological Services, so that the Ministry of Health can be able or easily access metadata from the Meteorological Department without any hassle, because I understand that Meteorological metadata is protected information, so you need to make some agreements. On the operational research on health sector needs for climate services, we managed to come up with what we call a readiness and climate service development operationalization 2, which was produced based on the Malawi experience. We also conducted what you call the field assessment of potential sentinel sites for the climate-sensitive diseases and surveillance in some of the pilot districts and the selected country in the zones. We also conducted what you call the data collection on climate-sensitive diseases, trend and spatial analysis modeling. We also conducted what you call the capacity building of the national and the district health coordinators on what you call early warning, alert and response system on climate change and health across the country in the districts. I'm also glad to inform the audience that during the COP26 in Glasgow, World Health Organization came up with what you call the WHO Health Initiatives commitments, namely resilience to health system, and secondly, sustainability, low carbon emissions, whereby countries were asked to commit to be the signatory. So I'm glad to inform you that Malawi, under Ministry of Health, did not hesitate, became one of the first countries in the African region to sign the WHO Health Initiative, COP26 initiative in Africa. And how this was through the commitment of our Minister of Health, who did not hesitate to endorse and sign and made this publicly.
Thank you. So it sounds like there was a mixture of effective lobbying within the government to get this built into different plans, and then some particular projects that also helped to galvanize the different teams to see this as a joint issue rather than separate. To go into this Green Climate Fund project itself, Burcu, it'd be great if you could talk us through a little bit about what the project is, and also the Green Climate Fund, if you could kind of unlock some of that for us and explain how it works and how you've got here.
Sure. Save the Children is the first and only child-centered humanitarian and development INGO accredited to the Green Climate Fund. With this status, we're able to unlock up to $50 million per project from the GCF. And we're working very hard to build a pipeline of about 11 projects at the moment globally. And out of the 11, about 3 of them focus solely in the health and climate space. And almost all of the rest of them have elements of nutrition and WASH and to some extent. We've done some analysis of the GCF funding to date, and based on the analysis and to the best of our knowledge, GCF has not funded any projects focusing solely on climate and health. GCF combines health, food, and water security as a single results area, and most of the projects in this category that have been funded to date are agriculture or water sector projects so far. We therefore see an exciting opportunity to develop some of the first ever health and climate adaptation projects with the Green Climate Fund, and we're looking for partners to work together to move the needle in this area. So how does GCF design work? A project idea is developed by the accredited agency, but this idea has to be first endorsed by the national designated authority. In Malawi's case, this is the Environmental Affairs Department. Once they've endorsed our idea, the design process begins, and this can take quite a long time. There's a lot of back and forth with the Green Climate Fund on the evolving design until it moves to proposal stage. Then it's a very intensive period of putting together a very hefty application, which is then submitted to the GCF board for approval. The GCF board meets 3 times a year, usually February, March, July, and October and November. And the application has to be submitted to the GCF board about 6 months in advance. And GCF are highly unlikely to approve more than 2 projects per accredited entity in a given board meeting. So as you can see, the ecosystem of Save the Children's own pipeline projects, which is about 11, that interact with about 70, I believe, projects that GCF have in the pipeline across 3 board meetings determine the speed with which you can move through the system to access the funding. The application itself is, as I said, a very resource-intensive process. There are a number of studies that need to be completed. In addition to the need to identify a co-executing entity from the government side, then we need to assess the entity's financial management capacities, conduct legal due diligence, all of which are compiled in about 20 different annexes in an application format that is more than 500-600 pages. There's also about a 10% co-financing requirement. This needs to be committed at the time of submission, and this can take a variety of forms. It can be new funding that will leverage the GCF investment. It can be also parallel financing, which is an existing project with complementary aims that can be proposed as, match funding, basically for the investment. In addition, we have to secure in-kind commitment from the government of Malawi. This is an absolute must and must be quantified at the time of application. So as you can see, this is far from your regular proposal development process. For Malawi Country Office, as Evie pointed out, GSK are providing the seed funding that we need to be able to develop this application. Without this seed funding, Save the Children, as an accredited agency, would not be able to bring this 36 million investment to Malawi. With these funds, we're able to build a team of a senior manager, a very capable technical consultant who is leading the technical application. We've hired a number of consultants who are developing the various studies and doing the field work and writing many of the annexes. With this funding, we're able to host regular meetings and consultations with the HCCT team led by Hendricks here and various departments of the government, and do a lot of the field work. So what is our GCF application about? The overall goal is to strengthen the climate resilience of the healthcare system in southern Malawi. It's a 36 million 5-year investment, which we hope to start implementing from next year onwards. It will be focusing in the most climate vulnerable and affected 6 districts in the south. Specifically, it's looking at reducing the risk from climate-sensitive diseases and conditions, which we've been discussing in the last couple of days, including heat stress, malaria, cholera, diarrhea, as well as mental health impacts, especially looking at the mother and child pair. Ensuring that the healthcare system physical infrastructure is able to withstand the climate risk. Ensuring that healthcare staff are better prepared to manage the impacts of climate risk, and communities are better prepared to manage the impacts of climate change on health. We'll be doing some really cool things with this project. Just to mention a few highlights from the outcome areas. For example, we'll be building the institutional architecture for the health early warning system in Malawi, in collaboration between the Department of Meteo Services and MOH. We'll be developing district and village level health adaptation plans, which will contribute to the HNAP at the national level. We will be formulating a national standard for what a climate-resilient healthcare facility looks like at all levels, from village to district to central hospitals. We will be developing guidelines for climate-resilient WASH facilities as well. We will be training healthcare staff on climate-related disease surveillance, nutrition and emergencies, on how to distribute early warning messages, building on some of the work that's already been started. On the community side, we will be working with community members on improved latrines, rainwater harvesting systems, and other technologies to prevent waterborne diseases. We'll work on the community knowledge on climate and health risks, and we'll specifically look at climate-responsive nutrition for children. So let me stop there, or maybe one more. In terms of the project structure, it is quite a complex structure, which we're still working with the government to agree on. But at the top there, on the international level, we have the Green Climate Fund that Save the Children Australia, who is the accredited entity as part of the Save the Children movement, together with EAD from Malawi government interacting. At the national level, we have 2 co-executing entities, and that is Save the Children Malawi and the Ministry of Health. And then at that level, we will be forming a steering committee that will also bring together all kinds of relevant ministries to look after the project. And there will be an independent project management unit that brings together the district and the national level implementers. I think I'll stop there. Thank you.
We don't have much time left. We were going to go into a bit more detail about what it means for the Ministry of Health to be a co-executing entity. But instead, I'm going to ask that if you're interested in that, to please grab Hendricks on the side and go into more detail on it. Because I think what's really important for the audience to see is what the next steps are and where this goes. Is there a slide on that, or are you just going to talk?
Yes, very briefly, the next steps are, I think we're very close to getting our concept note approved in the coming days. Once we go to the proposal stage, we have a very intensive 3-4 months ahead of us where we'll be compiling that big application and submitting at the end of July to GCF. Beyond that, there will be, some back and forth expected on scrutinizing various aspects of the submission. The aim is to be getting our proposal approved in Board 28, which will happen Q1 of next year. When we get that approval status early next year, I'm hoping that negotiations, contracting, setting up the PMU, etc., can start happening in the next 3 months or so. So from mid next year, we hope to be going live.
Great. Well, everyone keep your fingers crossed that that all goes to plan. As you can see, it's a super complex process. It's taken quite a long time already, but has potential to unlock these amazing funds. I know from our conversations that we could probably talk for a long time about some of the challenges and lessons learned. Once the approval has come through, I hopefully will be in a better position to share some of those learnings as well. But I'm sure any questions you have, you could ask in the coffee break, although I don't want to put too much pressure on the two of you to continue talking about this. But yeah, we look forward to hearing about how other people are able to unlock some funding from the Green Climate Fund for health adaptation. I think it's a really exciting source of funding, and it's big, so lots of impact that we could achieve. Thank you both so much.
Thank you. Thanks, Evie. Thanks, everyone.